ITV News Meridian can reveal that 1 in 5 frontline ambulance staff in Kent, Surrey and Sussex are currently half sick or self-isolating.
Well, it comes as managers at the South East Coast Ambulance Service, CCAM, hold urgent talks with the military about how soldiers could be drafted in to help. Kit Bradshaw has our exclusive report.
For almost 3 decades, Chris Blackman has worked for the ambulance service in Sussex. But at one point last year, he feared he might never return to the job he loves after contracting coronavirus.
I was unwell with flu-like symptoms initially, didn't think too much of it. Within a few days, I've become very unwell and ended up in hospital. I'm still suffering the side effects now. I have memory problems, concentration problems, breathing problems. So for anyone out there that's a denier, please take it from me, it's real.
Chris is now back at work, but many of his colleagues aren't.
I've been in this job 28 years and I've never known sickness like this. And most of that sickness is COVID related.
Out of the South East Coast Ambulance Service's 2,600 emergency personnel, 545 are currently off sick or self-isolating. That represents a fifth of the frontline workforce.
Crews are emotionally and physically exhausted. The shifts are much harder work than we've been before. We're managing patients in the back of ambulances for much longer amounts of time, and a lot of the patients that we're going to right now are much sicker than they have been previously within the pandemic.
The added pressure for ambulance crews when they make it to hospitals like this one are long waits to hand their patients over to doctors and nurses, and that means fewer ambulances out on the road available to respond to emergency calls.
The whole system in health and social care is under tremendous pressure at the moment, and it is very much a race against time between the vaccine coming in and the demand that's flowing through the system. And it's demand at all levels.
One option now being actively considered by ambulance bosses is drafting in the armed forces to help fill the staffing gaps. The neighbouring South Central Ambulance Trust used soldiers as extra drivers last year, with the fire service also called on to help.
We are not discounting any potential option. We have been working very closely with the military liaison officers to ensure that we are able to ask for whatever it is that they are able to provide. So that preliminary work goes ahead to give the military an indication of what we might be looking for and how they might be able to help us.
Frontline paramedics tell me of a service at breaking point. And despite signs that infection rates are beginning to level off in some areas, they're expecting the record high demand for their help to continue for weeks to come. Kit Bradshaw, ITV News, Brighton.